Scaling, also known as dental scaling or teeth scaling, is a common dental procedure performed by dentists and dental hygienists to remove dental plaque and tartar, calculus, from the surfaces of teeth. It is an essential part of maintaining good oral hygiene and preventing gum diseases, such as gingivitis and periodontitis. Here are some key details about scaling in dental care. Purpose: the primary goal of scaling is to remove plaque and tartar buildup from the tooth surfaces, especially in areas that are difficult to reach with regular brushing and flossing. Plaque is a sticky film composed of bacteria, food particles, and saliva, while tartar is hardened plaque that cannot be removed by brushing alone. Procedure: scaling is typically performed using specialized dental instruments. The dental professional uses a scaler or an ultrasonic device to carefully scrape or vibrate the plaque and tartar away from the teeth. The procedure may involve scaling both above and below the gum line, as plaque and tartar can accumulate in these areas. Techniques: there are two main techniques for scaling: hand scaling and ultrasonic scaling. Hand scaling. Hand scaling involves the use of handheld dental instruments, such as scalers and curettes, to manually remove plaque and tartar. The dental professional carefully scrapes the deposits off the tooth surfaces, paying particular attention to the gum line and the areas between teeth. B. Ultrasonic scaling. Ultrasonic scaling uses a specialized tool called an ultrasonic scaler, which produces high-frequency vibrations and uses water or an antibacterial solution to flush away the plaque and tartar. The vibrations help to break up the deposits, making it easier to remove them. Sensation and discomfort. During scaling, patients may experience mild discomfort or sensitivity, especially if their gums are inflamed or sensitive. The dental professional may use local anesthesia or numbing gel to minimize any discomfort. After scaling, some individuals may experience temporary tooth sensitivity, which typically subsides within a few days. Benefits: scaling offers several benefits for oral health, including a removal of plaque and tartar. Scaling helps to eliminate the bacterial biofilm, plaque, and hardened deposits, tartar, that contribute to gum disease and tooth decay. B. Prevention of gum diseases. By removing plaque and tartar, scaling reduces the risk of gum inflammation, gingivitis, and periodontitis. C. Fresher breath. Scaling can help improve bad breath, halitosis, by eliminating the bacteria responsible for the foul odor. D. Enhanced aesthetics. Removing stains and tartar buildup can improve the appearance of teeth, making them appear cleaner and brighter. Frequency. The frequency of scaling varies depending on individual oral health needs. Some individuals may require scaling every 6 months, while others may need it more frequently, such as every 3 to 4 months. The dental professional will assess the patient's oral health condition and recommend the appropriate interval for scaling. Scaling is a fundamental procedure in dental care that helps maintain optimal oral hygiene and prevent oral health problems. It is typically performed in conjunction with regular dental examinations and professional cleanings to ensure a healthy and clean mouth. Scaling, also known as dental scaling or teeth scaling, is a common